Middlesex County. We're glad you could join us. We're also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media in attendance this afternoon as well. We've already got a lot of questions in the queue, so I think the instructions on how to do that are probably well understood by this time. If you're tuning in this afternoon on Rogers Television, the Rogers Facebook page or YouTube channel, welcome. Also listeners on Global News Radio, AM 980 CFPL, and those tuning in on the CTV London website, a good afternoon to you all as well. Let's start with the opening remarks, and we'll begin this afternoon with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. So, as we know, case counts here in London and Middlesex are on the rise, and across Ontario, it's no different. In fact, today was the first day we saw more than 2,000 cases province-wide since late January. That trend is worrisome. But perhaps the only piece of positive news there is that the number of deaths, especially locally, have declined dramatically. Here in London Middlesex, despite our higher case counts, we haven't had a COVID-related death in more than 2 weeks. To me, that's proof the vaccination efforts are working. But as we know, this is a race. There are still many people in our community and across the province who have not been vaccinated. Some of them are highly vulnerable, others less so. But even with the decline in deadly outcomes, the potential for hospitalization and COVID spread remains. That's so important to remember, and that's really what these last 12 plus months have boiled down to. We simply can't afford our healthcare system to become overwhelmed. We can't afford Londoners, those across the region, getting sick. And we have to stop the spread. If that happens, everyone is impacted regardless of whether you have COVID. I know there's a lot of talk lately, and for good reason, about variants of concern. They're nasty, they're far more transmissible. But having said it, this is the key. They spread the same way. So what does this mean? It means we, all of us, can protect ourselves, our loved ones, and others the very same way, because the old cautions work against these new variants. Wear a mask, physically distance, avoid large crowds, stay outside when you can. All those things still work. The vaccines are here and the rollout is finally being ramped up. But that's no excuse for abandoning the best protection we have right now, and that's adhering to the tried and true public health protocols. Look, everyone's tired. I'm tired, but we're in the final mile. I want to see as many people as possible healthy enough to cross that finish line when the time comes. This is coming Saturday. Marks exactly 12 months since the first COVID-related death in London Middlesex. Since then, a total of 189 people, individuals, moms, dads, kids, grandparents, have lost their lives. I have an ask, and I'd like to see all Londoners turn on a porch or a balcony light, or place a light in the window on Saturday evening in remembrance, to remember those lives who've been lost as a result of this pandemic. It's the least we can do. I think it's important that we as a community pay our respects and honor their memories, while also letting their families and their loved ones know that we have not forgotten. Over to you, Warden Cathy.
Well, thank you very much, Mayor Ed. Today's jump in COVID positive cases is definitely a check for all of us. It is yet another reminder that the virus is among us, finding a way to spread. If what we are learning about the third wave is correct, we should be prepared for increases in case counts. As the Mayor mentioned, while case counts are up, we have not experienced a death in quite some time, and for that, that's good news. And I will take a moment right here to jump on what the Mayor suggested for Londoners, and I would challenge the residents in Middlesex County to do the same, to honor those that have passed the past year due to COVID, and light a light in a window in their home, and take a moment to reflect on those that have passed in the past year. While the weather has been beautiful the last week or so, and our municipalities seem to be coming back to life, it is certainly welcome after winter. As we have been reminded today, We still have to be incredibly mindful of respecting protocols and parameters that are in front of us. Physical distancing, washing hands, wearing masks is still the order of the day. Most importantly, the reminder to keep your bubble tight is still paramount. As tempting as it is to expand it, it is clear we are still not out of the woods, and your social circle needs to be a small one. While we see promises of making our way out of this, there's still work to be done. All this being said, I'm proud of the efforts that are being made by county residents and businesses. It's hard work, but it is clear that we are getting through this together. I have had the privilege to take on a few volunteer shifts at the vaccination clinic in Mount Bridges, and what a great experience it has been. I want to encourage you, when the vaccine gets open to your demographic, to please get it. I want to thank everyone involved in making the clinic in Mount Bridges come together as it has. It is a real team there, and it is evident as soon as you walk through the doors. The MLHU has done a remarkable job in recruiting people to fill positions. Middlesex County's Community Emergency Response Volunteer Team has had the opportunity to help support the clinic from the day the doors opened. Our commitment there will be coming to an end shortly, but I wanted to take this opportunity to thank the team for their efforts in supporting the Mount Bridges Clinic. Middlesex County is fortunate to have this group under our umbrella, and I know they have been excited to have been deployed at the clinic. I have been able to experience how our presence there has made a difference to the organization there. Again, thanks to everyone involved. Over to you, Dr. Mackie.
Thank you very much, Warden Burghardt-Jesson and Mayor Holder. I think our leaders have covered the main issues for today. The cases are up, big jump yesterday. The VOCs are way up. 15 VOCs is by far the most we've had, double any previous day. And fortunately, deaths remain low. That's a huge testament to the vaccine campaign. We are vaccinating the elderly, the people that care for them, and residents of long-term care retirement homes, where we know the vast majority of deaths have occurred. That said, if our current trends continue, we will see increases in deaths yet again here. There are a number of countries around the world that have higher vaccination rates than we do here, who have seen that if restrictions are lifted or behavior returns back to normal too soon, it will usher in another wave, a significant wave of cases and of deaths. And that's happened in a number of countries. So it's exactly what we need to be careful of here. The vaccine campaign is moving forward. It's moving forward as quickly as possible based on the supplies, but we cannot outrun human behavior if people start to take on more risks. The big climb in cases recently has been directly related to close personal contact indoors without personal protective equipment. That's been the cause of the vast majority of cases recently, as it has been for most of this pandemic. And so we, again, encourage people to keep your interactions online, outside, or masked, distanced. Take those precautions. They do make a difference. Thanks, Dan. I'll pause for questions.
Thank you very much, Dr. Mackie, Warden Burghardt-Jesson, and Mayor Holder. We do have a lot of questions, so let's get to them right away. Merrick Sutherland at CTV News is first up today. Dr. Mackie, this is for you, and it's kind of a lengthy question. Dr. Mackie, an international study released today says patients awaiting elective surgery are at high risk of contracting COVID-19, as well as an elevated risk of that infection becoming fatal, especially those awaiting cancer-related procedures. The study calls on governments to make these patients high priority for vaccines. So here's the question, it's a two-parter. Where do these patients sit within the priority framework? And two, what is involved in changing that designation if data reveals this as a high-risk segment of the population?
Well, a couple of things. First of all, there are many different segments of the population that are high risk, and there simply aren't enough vaccines to vaccinate everybody who is high risk right now. What we know from comparative studies is that long-term care, retirement home, and elderly over age 80 are at far greater risk than any other high-risk category. So if you compare even the highest risk health conditions, things like people who have had stem cell transplants or other organ transplants and are on medication to suppress their immune systems, those people are at higher risk, but those over 80 are at least double the risk level of those with any of the highest risk medical conditions. So, these folks with medical conditions that put them at risk are absolutely a priority. They'll be vaccinated as soon as possible. Certainly sometime in April, we will see vaccinations open up to this sort of group. The other context here is it is the duty of physicians caring for a patient to advocate for those patients. And so, it's no surprise that you see surgeons advocating for their surgical clients to get vaccinated. That is part of what is expected of any medical professional. And that's what's happening here. It's appropriate. And the current campaign is focused at those who are at the absolute highest risk. We'll be able to vaccinate those with health conditions like these as soon as we have supplies.
Thank you, Dr. Mackie. Next question is from Heather Rivers at the London Free Press. COVID cases rocketed up by another 100 this week. Actually, the number over the last week, since last Thursday to today, is 231, Heather. Heather's question, what are we doing wrong? Is this the result of St. Patrick's Day? And is another shutdown coming?
Yeah, I'm not seeing a lot of relationship with St. Patrick's Day or parties aside from that one large outbreak that we described last week. Essentially, you're seeing close contacts being the drivers here. We track the number of contacts per case. Each time we interview a case, we ask them how many close contacts they've had, who they are. And we're seeing that number continue to grow every week, where people are having more unprotected face-to-face indoor exposures. That's what's driving this pandemic. It's what has essentially always driven this pandemic. And if we want to see numbers stabilize and or drop, we've got to reduce our face-to-face indoor unmasked contacts.
Thank you, Dr. Mackie. And Heather's got another couple of quick follow-ups. And you touched on this in your opening remarks. Heather would like to know, with there not having been any deaths since earlier in March, I believe it's the 8th, is there a vaccination explanation for that? And if there is, what is the connection?
That's right, just one death so far this month. If you compare to November, we had similar rates of cases in November. By this time in the month, we'd had 6 deaths. So one is a major drop from that. And that is essentially all attributable to the vaccine campaign. We're getting the vaccine into the right arms and protecting people from death. The number one goal in a pandemic is to prevent deaths. The vaccine campaign is achieving that. We need to back the vaccine up as well by curbing our behaviors and avoiding those indoor, unprotected, unmasked contacts.
Thank you, Dr. Mackie. And lastly, Heather is asking, do you have any more details about what is happening with vaccinations in London? 3 drugstores have been announced by Southwestern Public Health as hosts for vaccinations. When are they coming to London drugstores?
Yeah, we have heard various rumors through pharmacies about AstraZeneca vaccine coming to them sometime along a similar timeline, perhaps in the next couple of weeks. We haven't heard any confirmation of that and no direct communication about it from the Ministry of Health.
Next question is from Celine Zadorsky at CTV London. Dr. Mackie, and we've touched on this a little bit, but there's another aspect to the question. We are slowly seeing the numbers rising over this past week. What are the concerns as we see the numbers trending upwards? And do you predict that we are on a path to stricter COVID measures?
Yeah, so we've kind of discussed, but the numbers are climbing because we have more indoor, unprotected, close contact sort of interactions. Do we expect increased COVID measures if we continue to see cases climb? We do expect that there will be increased restrictions. We may move to the red zone restrictions sometime soon, or even to the gray restrictions. That's certainly likely if we continue on the current trend. I would put that, at least a couple of weeks out, but if cases accelerate, it could be sooner.
Underscoring again the theme of this afternoon's virtual media briefing, which is maintain those public health measures. Keep your distance, wear a mask, and keep those surfaces clean. Wash your hands frequently as well. A couple of quick replies from Celine. Dr. Mackie, there have been more confirmed variant cases recently, just one more confirmed variant today, and many awaiting confirmation. Do we know what specific variants have been confirmed?
Yes, Celine, almost all of the variants here, so we've only had 4 variants confirmed. We haven't had any variants confirmed since January. All of what we've had are the screening positive. Now, all of those screen positive variants at the provincial level have turned out to be confirmed variants of one sort or another. But we just haven't had more confirmation results. So we know that they are variants of concern, we just don't know which ones. The 4 we've had here were UK variant. Vast majority across the province, over 90% have been UK variant. So it's highly likely that those 50 or so extra variants that we have here were also UK variant. We just don't have confirmation yet.
Right, and another question from Celine, Dr. Mackie, and it's about asymptomatic school testing. Have we had any results from asymptomatic school testing yet? And if not, can we expect some?
Yeah, we were able to work with the school board recently to pull those numbers. As of yesterday, there had been about 112 asymptomatic test results returned through the asymptomatic testing in schools, and 0 positives. So none of those 112 asymptomatic ended up being positive. And we also do lots of testing. When there is a case in school, the children in that class and teachers, anyone else with close contact also get tested. And so we have had hundreds of tests of asymptomatic students through that process as well. And only a very small handful have tested positive in the range of, again, 1 to 2%.
Thank you very much. The next question comes to us from Andy Yang at the Western Gazette. London is currently seeing an increase in daily case counts. Actually, I think we've addressed this question, Andy. Really no link to St. Patrick's Day activities. So thanks for the question. Jane Sims at the Free Press for Dr. Mackie. Chatham-Kent has been leading the province in getting needles in arms per capita. One of the strategies is to empty out the freezers and not hold back any doses. I know that was part of our strategy at the beginning of the month to get the 80-year-olds and older people vaccinated, but given today's spike in cases and the expected increase of vaccine supply, is it time to open up the Nichols vaccination clinic to get as many people in as possible and empty out our freezers too?
Yeah, so we're emptying the freezers here pretty quickly as well. The strategy we're using in London and Middlesex is what we call a earn and burn strategy. We are getting the vaccine out the door as quickly or quicker than it comes into our community, and essentially zeroing out with a day's supply or less by the time our next delivery comes in. We have about twice the capacity right now of vaccination appointments that we could provide in our clinics if we had the supply. So with the 3 clinics that we have open right now, Mount Bridges, Agriplex, and North London Optimist, together those could vaccinate 4,500 people per day. At the moment, we're receiving vaccines in the order of 2,000, 2,200 per day. So we got, again, more than twice as much capacity than we need with the existing 3 clinics. We've had our most recent allocation forecasting received just today, and out till over the next few weeks, the province is not expecting any increase in vaccines here. So, we'd love to have a good reason to open that fourth mass vaccination center right now. We just have nowhere near the vaccine that would justify that at this point.
Thank you, Dr. Mackie. The next question is from Sawyer Bogdan at Global News Radio, AM 980 CFPL. And this is related to the variants of concern as well. Dr. Mackie, the Middlesex-London Health Unit website, can't believe I got that wrong, is showing an increase of 15 variants of concern from the day before. Is this a cause for concern? Also, there is one case of the E484K mutation. And there is that one, and I know it's been a busy morning, there is that one confirmed that has been added to the dashboard today. That mutation, the E484K, has been linked to the Brazil and South African variants. Is there a concern about these VOCs in our community and the effectiveness of vaccines to protect against them?
Yeah, thanks for the question, Sawyer. The majority of variants in Ontario have been UK. Data from UK is showing that the vaccines, all of them, including the Oxford AstraZeneca vaccine, are effective, not perfect, but very effective at preventing the UK variant. It is important that the 484 variant is one that also demonstrates not just increased ability to spread, but also evading some of the immune response. And so that's an important variant to be watching. But still, there's still data that the vaccines can help prevent that. The big question is whether we can get ahead of their spread in terms of preventing deaths. And of course, what impact the weather changing will have. We know that it made a big difference last spring, summer, when the weather started to break. Will that still be the case here with the new variants? Something we're watching closely.
Thank you, Dr. Mackie. Jane Sims is in with another question. Dr. Mackie, the provincial vaccine tracker counted more than 71,000 shots yesterday. Our numbers haven't been updated since March 14th. How many more people have been vaccinated in Middlesex-London this week and in total?
Yeah, so our numbers haven't been updated since March 14th. So we have been vaccinating between 600 or 700. Yesterday we hit a high of 2283 over the past week or so. The vaccination rate is, again, entirely dependent on supply. We had lower supply last week, earlier on. Yesterday we got a big delivery of Pfizer, so we were able to increase the appointments in clinics then. So really, we're vaccinating as the supply comes in. Did you have something you wanted to add there, Dan?
Well, I was just taking a look at the online dashboard, Dr. Mackie, just to follow up on Jane's question. And just for some added context, the columns that are reported on the dashboard per week, that's for the previous week. So for instance, we updated the dashboard on the 23rd of March, so on Tuesday, for the week that started on the 14th of March. So that column there is for last week, Jane. And if you look right next to that, the total doses administered up to the end of day, March the 21st, was 64,783. So again, those weekly numbers get updated on Tuesdays on the dashboard, and they are for the previous week. So just wanted to add that little bit in there. Next question, Travis Dullany at CBC London. Dr. Mackie, there hasn't been a COVID-related death reported for over 2 weeks now. Now that the most vulnerable are being vaccinated, do we expect fewer deaths than the previous waves? Are there concerns that more younger people may die due to the variants of concern?
I think we answered most of this, but the variants spread more easily. They don't kill more easily. So certainly, more cases could mean more deaths in younger people, but younger people remain at very low risk of death. The biggest problem with spread in the young is they pass it on to the elderly and those otherwise vulnerable.
Thank you, Dr. Mackie. Next question, follow-up from Jane Sims at the Free Press. Dr. Mackie, Chatham-Kent has opened up appointments for people 70 years of age and older. York Region announced today it will be expanding to 70 plus. Do you know when we will be able to open up to that age band in London and Middlesex County?
Yeah, we don't have an estimate for when we'll be opening to 70 plus at this point.
Next next question is from Sawyer Bogdan at Global News Radio. Mayor Holder, this one's for you. Mayor Holder, can you elaborate on the decision not to grant access to the bandshell in Victoria Park for tomorrow's Stop Asian Hate Vigil and rally? And then a follow-up question for Dr. Mackie, keeping in mind that the health unit declared racism a public health crisis last year, what is the health unit's view on tomorrow's rally from a COVID standpoint? Were you relieved to hear organizers are taking a primarily virtual approach? So Mayor Holder, we'll start with you.
Well, thanks very much, Sawyer. I think that tie into the virtual approach relative to the bandshell is an important one. I have to say at the outset, racism in any form is absolutely unacceptable, and I stand with those who really condemn hatred and bigotry. I want to make the point that I do understand the need to want to respond and respect the spirit of what the rally is intended to do. The fact is, given where case counts are right now, these types of gatherings just aren't safe. And how could I justify or encourage providing facilities for an activity that increases the risk of spread? You know, it's why last weekend's gathering is under investigation and should result in charges. The intent, let's look to that. The intent behind tomorrow's rally, it's one I support, but I can't support activities that have the potential to increase spread. And I do applaud the organizers for taking a virtual approach, and I hope that all Londoners who want to show their support do the same.
Dr. Mackie.
Thanks. I mean, so racism is a public health crisis. It's so disturbing to see racism turn towards Asian people. Obviously, racism in any form against any group is completely unacceptable. I think that, well, I hope that anyone who is involved in planning, organizing, or attending any such event will do so as safely as possible, including keeping distance and wearing masks. You know, the right to protest is an important right, but absolutely we should be taking steps to keep each other safe, particularly now.
Thank you, Dr. Mackie. The next question we have is from Jane Sims. Actually, I'm going to get back to Jane on that. Wendy Spence at the Dorchester Signpost. For Dr. Mackie, with regards to the COVID vaccine, after reading about Chatham-Kent long-term care workers, what has the percentage of uptake been like in the Middlesex-London health unit area among healthcare workers, those who work at long-term care and retirement residences? Is the COVID vaccine mandatory for nurses, doctors, PSWs, etc.?
So at this point, I'm not aware of any organizations in our area that have made the COVID vaccine mandatory. One of the issues, of course, is that in the context of scarcity, it makes sense to get the vaccine to those who are eligible and want it before we get to the point of forcing anyone or making it mandatory. And so that isn't something that is happening right now. We don't have data on percentage of uptake across healthcare workers across all areas. We know that early on, we were able to get many people in long-term care and retirement homes, staff vaccinated, and estimates were easier to provide at that point when that was the main group getting vaccinated. We don't have at this point an estimate of all the staff in healthcare that have been vaccinated in the region.
Thank you, Dr. Mackie. And we have one last question from Andy Yang at the Western Gazette. Dr. Mackie, are there any new cases associated with the student outbreak related to partying?
Yeah, thanks for the question, Andy. We haven't got any new cases in the last week or so.
And that is it for the questions, and gets us right to 2:30 this afternoon. So everything like clockwork today. It's kind of unusual for us, but we'll welcome it and we'll take it. Thank you very much for your time this afternoon. We appreciate you joining us. We will be back for our next virtual media briefing next Monday afternoon at 2 p.m. So between now and then, take care, keep your distance, sanitize those surfaces, and wear a mask. So long for now.